Your heart works every second of every day. Shouldn't your supplements work just as hard? Introducing 3 powerhouse cardio support products from Protocol for Life Balance. Nattokinase, drawn from a centuries-old Japanese tradition. This remarkable enzyme helps maintain healthy blood flow and normal blood fluidity. Circulation you can count on naturally. Next, ubiquinol. This is the active form of CoQ10 your body actually uses, fueling cellular energy production, neutralizing harmful free radicals, and delivering superior absorption. And finally, clinical cardio 6. 6 powerful nutrients, 1 capsule, including L-carnitine to energize your heart, hawthorn, and mega natural BP grapeseed extract for healthy blood pressure, and MK7 to keep your arteries flexible. Comprehensive cardiovascular support, all in one. Protocol for Life Balance, science-based professional-grade products using ingredients backed by strong research. To order, go to drhoffman.com/protocol for life balance. That's drhoffman.com/protocol for life balance. Protocol for Life Balance is an A-rated GMP manufacturer of premium dietary supplements. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman, tremendously excited about today's guest, who is Dr. Elizabeth Mumper, who has practiced pediatrics for 44 years. She is a veteran of both practicing pediatrics, but also teaching clinicians in 21 countries and around the United States. And she has a unique perspective on kids and COVID. In fact, has written a book entitled Kids and COVID, where she laments all the mistakes that we made in relationship to our campaign to protect, supposedly, our kids. And so I just want to get back to kids in particular, because one may argue that a vaccine campaign for, as the Great Barrington Declaration advocated, is that we need to protect the vulnerable. We need to protect older adults. We need to protect people who have underlying illnesses, so-called comorbidities. But to extend the vaccine campaign to kids, now the rationale was make sure your kid gets vaccinated because you don't want to kill grandma and grandpa. Well, what's wrong with that line of reasoning?
Well, Ron, that line of reasoning really upset me because I looked hard for evidence that that was happening. And first of all, kids survive COVID 99.9987% of the time. And so parents did not have to be that concerned about a really bad outcome for their child. But moreover, when we looked at the issue of household contacts or children bringing COVID home to the grandparents, there were a number of good studies that were collated by some colleagues in Vermont that showed that just was not happening.
In fact, it was kind of the
And
opposite.
thirdly,
It turned out that the kids may
yes,
be acquiring it from adults, but in a milder form.
exactly. And the other issue is on an ethical note, in war, we don't use kids as shields, to protect the adults. Adults typically in most cultures have this moral responsibility to put their child's well-being above their own. So this idea that we would expose them to this new technology to supposedly keep the virus away from the grandparents, I think was shaky just on the assumptions it made. But I'll tell you, Ron, one of the most poignant things in my entire 44-year career was when I saw a young boy with COVID. We never shut down during the pandemic. It never occurred to me to do that. I was a doctor, and doctors take care of sick people. So I didn't understand why this was so different. But he had COVID. He wasn't very sick. So I was giving him my little talk about, the good news is that your body knows how to take care of this. I want you to take some extra vitamin C. Your mom's going to give you a lot of fluids. She may give you some extra oranges. And, we have some vitamins that can help you. I particularly pushed vitamin C and D. And you're going to be better. And just a couple of days. And he looked at me terrified and said, "But am I going to kill my granny?"
Oh,
Isn't
goodness.
that an awful
Yeah,
burden to
yeah,
put on young children? He was
yeah,
5 or 6 years old.
yeah.
I thought it was despicable the way that played out. So there was never really evidence that that was going to happen. And In my opinion, the kids did not need a vaccine that was not well studied in childhood. Um, my other gripe about this was that even though the adult studies had like 22,000 patients in each arm, which is, a pretty robust study, some of the pediatric studies, one of them started out with about 4,000 patients. But then when they ended up reporting it, about 3,000 of those patients had dropped out.
Hmm.
And I wasn't sure why. And, one wonders, did the parents realize they were having side effects and, were afraid to go on? If you or I did a study like that
Yeah.
and presented it to our
It's
residency
suspect.
director,
Yeah.
we would get an F on that project because
Yeah.
you can't lose that many patients in a study. And then one of the other studies on the boosters had 137 patients in it. So even the study that had 1,000
Yeah.
patients in it wasn't enough to detect rare side effects.
Well, you know what? Some of the studies were based on, this problem I have with it is based on antibody response. In other words, if the study
Exactly.
showed that the body, it elicited an antibody response, it was considered a home run. And then we didn't really look at outcomes.
You're exactly right, Ron. They use this sort of concept called immunobridging, where if there response, they kind of made the assumption that the immune system would do a good job and that people wouldn't be as sick and that people wouldn't die as much. But they really didn't look at the outcomes. And that was a huge, I think, error, as you point out.
Indeed. Uh, so the other consequence to kids, perhaps even a more profound consequence, was widespread masking. Now, part of in terms of your subspecialization, you're a neurodevelopmental expert, which is dealing with kids' brain development. What are
Yes.
the consequences of taking a toddler and masking that toddler and masking their teachers, their parents, their grandparents, all the adults they interact with for a period of many months and in some cases for several years at a crucial window of neurodevelopmental acceleration?
In a word, it was disastrous. Babies who grew up with their caregivers wearing masks showed about a 20% decline in their infant developmental scores. To draw an analogy to the IQ test, which your audience will be more familiar with, it would be like the average IQ of people all of a sudden dropping to around 80 instead of being around 100. So, for infants who are trying to learn about their world primarily by gazing into their parents' eyes and reading their facial expressions, it was terrible. Not to mention the fact that babies learn to talk by watching their parents make language and looking at their mouths move and the way that their lips and tongue are moving. In some crazy times, they were even trying to do speech therapy with masks on, which makes no sense at all. In the toddler age range, one of the main things you want to learn at that stage of life is how to read people's emotions.
Mm-hmm.
Toddlers need to figure out, are you happy with them? Are you mad with them?
Mm-hmm.
Are the kids you're playing with getting irritated because you're insisting on your own way of doing things? And all that was so disrupted by mask wearing. But for the kids with autism, it was even more of a disaster because studies have shown that whereas your child or my child might look at our eyes mostly when we interact, kids with autism preferentially look at the mouth and the
Mm,
lower half of the face.
interesting.
So all of a sudden, they didn't get any of that feedback. And it made it so confusing for the kids with autism spectrum disorders. And, that's not even taking into consideration the fact that the masks aren't effective for a virus that's that
Mm-hmm.
small, that so many people wore them under their nose, or the little kids would hang them from one ear part of the day. Um, Teachers had a really hard time getting kids to keep the masks on. I think they weren't necessary, and I think they significantly adversely affected the child's development.
What about all the school lockdowns and the switch to Zoom instruction as well as the kids' over reliance on social media during that time. I think that was the fallback. People,
Well,
because
I
kids
think that
were
was,
isolated. Literally,
yes.
as I lived in New York, they literally put, yellow tape around playgrounds, as if it was a crime scene tape around, and you couldn't access these things. So I had this with kids in my family that they literally could not go outside.
And that made no sense either from an infectious disease standpoint because the virus isn't going to spread outside in kids that are playing on playgrounds. But there's several things that happened with the lockdowns. First of all, it was absolutely devastating for teenagers. For a teenager, their peer group is the most important thing to them. And very early in the pandemic, within the first month or two, the suicide and attempted suicide rate in teenagers doubled,
Hmm.
and it stayed elevated for quite a bit of the pandemic. um, Adolescents turned to social media, spent more time on their screens. There have been a lot of studies now that show that when kids are depressed, looking at social media and seeing other people's vacations or wonderful food that they're eating or people that they're visiting is very bad for their mental health. Think about how much sense it makes to put a kindergartner in front of a screen. Kindergarten kids have very short attention spans. Bless my son in law, who tried to teach kindergarten on Zoom through the pandemic. And much of the time, the kids were turning off their videos and taking naps or, playing. And it was a ludicrous ask of him. Um, that kind of learning is just not validated for young children who really need to learn through observation and handling items and what's called kinesthetic learning. So, educators are concerned that the time that was lost is not going to be able to be made up by the time these kids get to college or high school. They're concerned that they're gonna we're gonna in the future see more high school dropouts because they're lost about 2 years of learning, and so far it doesn't look like they're catching up very well. And so I have a lot of concerns about both the mental health of COVID babies, toddlers, elementary school kids, and adolescents, as well as the long-term outlook for their educational progress.
What about older young people? Because the colleges were shut down for a while, and then they opened up, but it was mandatory to get the vaccine. Same thing in the military. Same thing in many jobs, especially jobs where the government had some purview over how the business was run. Gyms were closed, which is, I think, an important outlet for young people. And it appears that
Yes.
there were some unique susceptibilities of young people to the vaccine, especially for some reason, young males. What's going on there?
Yeah. So, first of all, in my mind, not ethical to mandate a vaccine that was experimental. And so that's a big problem right there. Um, and to force people to choose between being able to go to college or having to take an experimental product that they may have had, you know, either medical concerns about or religious concerns about, or personally significantly held beliefs that it was not the right thing for them. So there are all those issues. But young men, especially in the 15 to 34 age group, seemed quite susceptible to get myocarditis and or pericarditis, so inflammation of the heart or the sac around the heart as a result of getting these vaccines. And I was shocked. I was listening to the June of 2021 ACIP meeting, that's the American Committee on Immunization Practices. And at that time, they already had data that showed that in certain age groups, the prevalence of myocarditis was going up 12 times in the kids that got the COVID vaccines. And during the discussion period, they were talking about how they thought it was going to be a kinder, gentler myocarditis, that they hoped it
It's
wouldn't
only
have
mild
long-term.
myocarditis.
Yeah,
It usually resolves. Yeah.
that was the attitude, and I do not think they had the data to support that. I think it was kind of wishful thinking. And so now we, have these young men who had significant myocarditis. I know of a case where the guy was a nationally ranked bodybuilder, and after the vaccine got myocarditis and couldn't walk up one flight of stairs without being winded, and is still disabled 3 years later. And there are many, many young men who were out of their sport or out of real life for 6 or 8 months and are still having to take cardiac medications. So, given the fact that they were not at risk to die or have myocarditis from COVID itself, that seemed like a very poor trade off, in my opinion.
Indeed, we're talking
Um,
here about a risk-benefit equation. The benefits very scant and the risks fairly substantial. So this is always how you
yes.
have to weigh a medical decision. Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up. Ever walk into a room and forget why you're there? Lose your train of thought mid-sentence? Feel like your brain is running on fumes by 2 in the afternoon? Try Kyolic Specialty Series Smart Mushrooms Plus. This isn't caffeine. It's not some jittery stimulant that crashes you an hour later. This is a clean, science-backed formula built around certified organic lion's mane mushrooms, clinically shown to support the nerve growth factor that actually helps your brain maintain and organize neurons. We're talking real foundational support for focus and mental clarity, and it doesn't stop there. It's combined with Kyolic Aged Garlic Extract, aged up to 20 months on organic California farms, plus Aronia Berry Extract, selenium, and vitamin B12 for long-term brain health and executive function. 2 capsules with a meal, once a day, vegan, non-GMO, no gluten, no dairy, no artificial anything. Kyolic Smart Mushrooms Plus from Wakanaga. Learn more about this and the entire Kyolic Mushrooms Plus line at kyolic.com. That's KYOLIC.com. Look for Kyolic at natural health stores nationwide and online. Thanks for listening. Thanks for supporting our sponsors, because they are what make Intelligent Medicine a continuing free resource to you. And now back to today's guest, Dr. Elizabeth Mumper, author of Kids and COVID. So we talk
Yeah.
about informed consent. This is an important concept in medicine. And how were the precepts of informed consent traduced or trampled upon during COVID?
Well, when you have a mandate, you really aren't giving people informed consent. Theoretically, anytime you consent to a medical procedure, whether it's a vaccination in my office or a surgery at the
Even life-saving
hospital,
surgery, you have to sign,
yes,
these are the risks, and yeah.
yes. And you're supposed to be told not just the risks and the potential benefits, but also any reasonable alternatives.
Hmm.
So theoretically, people should have been told, well, you can get this vaccine. There are all these risks that we know of, probably some risks we don't know of. The benefit, frankly, in a young child isn't probably that much. And then you're supposed to be able to make an informed decision. And informed consent also implies informed dissent. So after you're informed, you should be able to say, no, thanks. I don't think this shot is right for me at this time. I really don't want to take it. But when it's being mandated that you either have to do it or lose your job, or that, you've been in the military 19 and a half years, and if you don't get the shot, you're going to be discharged without your 20-year pension, or you're at a job where you are required to either, get the shot or lose the means to support your family. That kind of coercion, that kind of pressure, that kind of manipulation is not part of truly informed consent.
Well, there's some commentators, and this doesn't age well. We actually have, through the miracle of videotape, we have commentators who said we should make it really tough for vaccine refuseniks That's what they called them, to live. And, we're going to really put the clamps on these people. I experienced this in New York. I could do virtually nothing. I couldn't go to the gym. I couldn't go to a restaurant. I couldn't attend any kind of public meeting or a concert or Broadway play without flashing my vaccine card. That was, just the way things were done in 2020 and 2021.
Yeah, and I think that was a really bad precedent because that essentially demonstrated how effective propaganda can be and how effective these fear campaigns can be, and how we can utilize social media to manipulate people's behavior. The government, the CDC, I saw the data on this. They actually hired a bunch of social media influencers
Mm-hmm.
who mostly dealt with how to put on your makeup and how to do your hair and what fashion was, and got them to tell their followers that the vaccine was a good thing and that that's what they should do. That was totally inappropriate, and it was done with our tax dollars. um, going to the gym is many people's way of handling their stress. Going to the playground or being out in nature is an excellent thing for both physical and mental health. And to shut all those health promoting activities down in the name of trying to contain the virus, it really was not a it really didn't follow um, the established rules of good public health, in my opinion.
So, on the other hand, should people who took the vaccine and tolerated it, maybe had some arm soreness and went on to lead normal lives, went on probably also to get COVID because there was no surefire protection against COVID, but perhaps it
Right.
enabled them to have a milder course of COVID, or certainly
Of
wasn't
course.
the shield that it was claimed to be. Should those people be worried that they might eventually develop? There are rumors of turbo cancer and long-term devastating side effects, such that people are nervously reaching for nostrums remedies to rid their body of spike protein. I mean, that's a thing now.
Yeah. So hope what we've seen so far, it seems to me, is that the people that develop turbo cancers and myocarditis tended to have it happen relatively soon after the injections. So people that got the injections when they first rolled out in 2021, who seem okay now, I hope they're going to be okay. But I'll tell you, Ron, the phenomenon of turbo cancer is definitely real,
Hmm.
and it cannot be explained away by the fact that people miss their mammograms or miss their colonoscopies, because what we're seeing is these turbo cancers in really young people,
Mm-hmm.
like 29-year-olds getting colon cancer and it's diagnosed at stage 4, or
Hmm.
23-year-old women getting breast cancer and it's stage 3 or 4. It was very different from the kind of cancers that would have been picked up by the typical screening recommendations that are in place. So I do worry a lot about the turbo cancers. I have colleagues who are oncologists that noted this pattern of people that had been in remission from their melanoma for 10 years. All of a sudden, it
It's
comes back with a
reactivated.
vengeance.
Yeah.
And Dr. Danglish, who's one of the best oncologists in the world, just spoke to Congress about this last week. And he has significant data to support that the turbo cancer thing is real. I'm also very worried about the long term neurologic side effects. Some subpopulation, again, they tended to react fairly early on, but they've had things like transverse myelitis, which affects their ability to walk, inflammation around the spinal cord. They've had the small fiber neuropathy that gives them the burning under their skin or the tingling or the vibrational sense, and is very distracting and debilitating. or people who got tinnitus, where they hear ringing in their ears that's so loud that some of them have actually committed suicide because they couldn't
I've
take
seen
it
that
anymore.
even in my relatively small cohort of patients who took the
Yeah,
vaccine. Yeah,
yeah.
very devastating.
So I do worry a lot that, Ed Dowd, who wasn't a health person, he was actually a financial guy, but using the government's own data, he showed significant increases in both death and disability, not so much related to COVID itself, but related to the year of the rollout of the vaccines. And one of the most shocking statistics that he shared is that in the first year of the vaccine rollout, in young people in the working age population, there were 60,000 excess deaths. So mortality was 60,000 more of those working age people died than typical. And if you think about that, Ron, that's very close to the number of men and women that died in Vietnam, and that was over a 12-year period. So for those listeners that have gone to the Vietnam Memorial in DC and seen that incredibly powerful wall, think about that number of people um, that are young dying in the prime of their life in conjunction with the rollout.
Yeah.
Can't prove the actual causal link from what I've just told you, but very, very concerning data. And also the disability data is very concerning.
In your book, you talk about something called the cell danger response.
Yeah.
What's up with that?
Yeah. So this highlights the work of one of my colleagues who's just brilliant. His name is Bob Navio. And he has done incredible work showing that many chronic diseases occur when people get stuck in the cell danger response. So, to briefly explain it, when a cell is under danger, and that might be things like there's a virus or there's a bacteria or the surrounding area is a little too salty or not salty enough, or there's a heavy metal on board, or, there's psychological stress. It can be so many
It's
different
known
things
throughout the animal kingdom, from the single cell life
throughout.
to the most
Yes.
advanced life forms.
Yes, and a lot of Bob's work was actually done on earthworms in the beginning. So very well described. And you want to have that happen initially, because the cell locks down. It's kind of like a fortress, and you bring the moat up, and you get your people isolated from the surrounding areas so they're not invaded. And the cell squirts out bleach to try to kill whatever it is that's aggravating it, and it also sends out messages to the surrounding cells that says, we're in danger, don't do your usual things
Mhm.
because we've got to all hunker down and wait this out.
Don't
Well, when
expend
people get
additional
locked,
energy because we need to
yes,
muster all that energy for our immune response and our defense. And hence, that's what happens when
exactly.
you have a cold or a flu. You just don't feel like doing anything. You want to just lie in bed and, you know,
Right.
yeah.
And that's adaptive to want to sleep, to isolate yourself from other people so that you don't give the virus or the germ to them. But if you stay locked in cell defense mode, then you get chronic illness. And he makes a very good case that um, over 100 chronic illnesses that he has identified are associated with not being able to get out of the cell danger response.
Mm.
So, a lot of the work that those of us like you who do integrative or functional medicine, what we concentrate on is how to restore the cells to health. We have to think about our patients on a cellular level. And it usually involves things like giving mitochondrial support. The mitochondria aren't just the powerhouses of the cell, as we all learned in high school biology, but they're also like a taxi dispatcher where they direct a lot of action of the cells and the cells surrounding them. We work on oxidative stress. That is when you have too many reactive oxidized species circulating, and that puts you in a situation that tends to cause acidosis and difficulty healing. So, really, going back to basics is an important part of recovery when you are suffering from long COVID. long backs, other chronic illnesses, too numerous to mention.
But the thought is that perhaps for some people, some vulnerable individuals, and perhaps it's genetic or perhaps it's due to, some as yet undetermined factors, that some people are uniquely susceptible to going into a cell danger response when they're challenged with a vaccine that causes their body to manufacture something which is a foe, the spike protein.
Exactly. Yeah, when you look at it from the cell defense standpoint, the the theory and the enthusiasm behind the mRNA products and the idea that it's going to teach your body to make something that's inherently dangerous really loses its luster for me.
Indeed. I mean, yes, just on that, it just seems a little unsavory. It's like, what could possibly go wrong? Uh, okay. Also, when it comes to COVID therapeutics, we waited long and hard for an effective drug to be developed for the treatment of COVID. We, said that ivermectin was horse pace. We said that hydroxychloroquine was a waste of time. And we said that, vitamins have a paltry effect. And then we came up with a cure, which is Paxlovid. What's your take lately on Paxlovid? And it's, something that President Biden, avidly took when he came down with COVID. Of course, he suffered from something called Paxlovid backlash, which is when you stop, the COVID comes back with a vengeance, and, you have to restart the Paxlovid. Kind of a mess.
Yeah, I was never a fan of Paxlovid and I never prescribed it for my patients. I was concerned that it was a temporary fix and that it set you up for risk of getting COVID later. I think that people should have come to the realization that all of us were going to get it at some point or another, and not to really hold out the hope that they were somehow going to escape it. My colleagues that seem to have the most success with treating COVID use things like ivermectin, hydroxychloroquine, nattokinase, vitamin C, vitamin D, quercetin to be a mast cell stabilizer.
Mm-hmm.
There's so many things that are part of an integrative physician's toolbox that can be used with a much lower side effect profile and better efficacy, in my opinion.
Indeed. All right. Well, I think this is just a bit of a taste of what's in store for you if you read this great book, Kids and COVID. The book is by today's guest, Dr. Elizabeth Mumper, and she just does a deep dive and just, using her perspective as a pediatrician, bringing to bear, decades of knowledge about how to properly treat kids, when to hold and when to fold about aggressive therapies. Because I think being a pediatrician, it's a lot about that, because there are a lot of options that we have in medicine. I think a lot of the approach that a judicious pediatrician needs to use is to evaluate our arsenal of therapies and decide, what is most appropriate for a small child with a delicate constitution, with, as you mentioned, the potential to experience a series of infectious diseases and kind of program their immune system in a natural way, which is as nature intended, rather than to rely on various forms of outside intervention. I think that this is an important perspective for parents going forward, but it's also, I think with COVID, we had a very teachable moment. How can we avert future mistakes?
Well, I totally agree. You've vocalized that very well, Ron, because I view childhood as a bit of an adventure through various infectious diseases. And I bemoan the fact that we've overused antibiotics consistently in this country. We do a worse job of that than people in Europe, for example, who tend to recognize viruses and not bow to the pressure of writing a prescription for an antibiotic that's only going to kill bacteria, not viruses. I do hope that parents, if they do read my book, I want to empower them to really believe in their own intuition and their own judgment. Nobody knows a child as well as the parents. And it's important for parents to realize that if their child's behavior changes, there's usually a reason for it. And simple measures like extra hydration and rest and the good nutrition that includes some of the vitamins that we've been talking about can really go a long way, because children are inherently pretty resilient. They do have these excellent innate immune systems that need to be trained along the way. And I think for the most part, the grown-ups need to first do no harm. We really have to evaluate the recommendations we make for children to make sure that the side effects aren't worse than the actual condition that they have, which for most of the time is going to be transient, and they're going to get through it just fine.
Indeed. Well, I think that's an important message for parents and caregivers. So I want to thank you very much for writing the book, and thanks for your great work, and congratulations on a marvelous professional career.
Thank you, Ron. It's been such a pleasure to talk with you.
Indeed, likewise. Thanks for joining us. That's Dr. Elizabeth Mumper. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant, and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs: heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com.